Hi everyone, my name is Sydney Vickery and I'm the epidemiologist at Huron County Public Health, and today I'm going to be going through the Reporting Communicable Diseases training. So if you're new to reporting and you're not sure how to do that, we'll go through all of that in this training. So this is a good training for you if you are new to reporting. Also, I'm going to go through some of the more recent updates. So if you have been reporting and you already know how to do that, this will be a refresher for you, but it'll also include all of the new updates. And before we begin, I'm going to ask that you take the pre-training survey. So if you want to get a certificate of completion for this training, you'll have to take the pre and the post-training survey. So first, before we begin the training, you'll want to take the pre-training survey. So you can copy and paste the link that is in the notes section or in the link below on this slide here. So over in the notes section on the right hand side, you'll see a link for SurveyMonkey and it says pre-test above it. That's going to be the one you want to take. So I'm going to try and give you a little bit of time here and I'll go through the layout while you complete the pre-training survey. So again, you can get a certificate of completion. Just take the pre-training survey and the post-training survey. And I'll go through the post-training survey at the end of this presentation. On the right-hand side, you'll see the notes section. The notes section is going to contain all of the information that you need for taking the surveys and what emails you'll receive your certificate through. So you'll receive it from SMAR at Huron County Public Health. And file 2 is the section below that, and that includes all of the forms and information that I'm going through today. And I'll make reference to this box whenever there's a new form or a file that you could use. I'll make note of it and I'll let you know the name of it so that you can download those files. You don't have to go anywhere else to find them. Okay, so if you're not done with the pre-training survey at this point, just pause the video and then start it once you have completed it. So the outline for this presentation is, first I'm going to go through the diseases that are reportable by Ohio law. So I'll go through that first and explain which ones are reportable. Then I'm going to go through the reporting time frames, and I'm going to break down the diseases that are reportable a little bit more based on the time frames they have to be reported in. Then I'm going to go through using reportable disease forms, so how to use the forms that you need to use to fill out to send to us, and then how do we at Huron County use that information. So then I'll go through that as well. So first, diseases are reportable by Ohio law. It is at Ohio Administrative Code Chapter 3701-3. So that's where you can find all the information about the reportable diseases. This file here is nice to look at. I'm going to zoom in a little bit for you. So this is the Know Your ABCs form. And this is all of the diseases in Ohio that are reportable by law. And again, it's effective as of September 16, 2016. So this can be found in the Files section under Updated ABCs Reportable Diseases. So that's where you will find this form. Now this form breaks them up into classes. There's 3 classes, Class A, Class B, and Class C. So you can see here's Class C at the bottom, and I'll go through each one of those a little later, sorry. And then over here is the Know Your ABCs link. So this link is going to take you to the most updated communicable diseases that are reportable in Ohio. So if you're taking this training and it's well after October 2016, you can always go to that link and get the most updated ABCs form. That'll have the list of all of them for you. So if it has been a while since this training's been made, you want to make sure you have the updated one, you can go to that link as well. And this presentation as a whole is in the files section as well under Communicable Disease Training, so you can go and find those links there as well. So we have 3 classes for communicable diseases. The first one is Class A, as you can see here. And Class A are diseases that are of major public health concern, and that's because of either their severity of disease or their potential to spread. So those are of major concern, and those diseases include things like anthrax, botulism, measles, smallpox, human rabies, plague, Ebola, yellow fever, rubella, those type of things. In one case is an unexpected pattern. We shouldn't have any of these illnesses, and that's why they are of such high importance. We don't want to see any of them, so they are considered Class A. Then we move down to Class B, and Class B is a lot bigger class. You can see there's a lot more diseases under this umbrella, and Class B is of public health concern, so we still want a timely response because of the potential for the epidemic spread. However, it is not as high of a concern as Class A. So for Class B, things in there included are Zika virus, chikungunya, Campi, E. coli, salmonella, hepatitis A, B, C, malaria, meningitis, pertussis, syphilis, chlamydia, gonorrhea. So we have a large array of illnesses that are under Class B. And then Class C is the last class that you can see here. And that class is any other disease that is not listed above if it is an unusual incidence or there's an epidemic of the disease. So anything that's not reportable, but we notice that it's unusual or there's a group of people that have something in common and they all have this illness. So things like that can include a nursing home with 10 people with scabies. That's abnormal. Now scabies would be reportable. Or we have a football team and 4 of them have MRSA. That would be an outbreak and it would be reportable. So that's our Class C. So that kind of encompasses anything else if it is an unusual incidence. And then it would be of public health concern. Okay, so now we're going to move on to reporting timeframes. So for Class A, again, like I had mentioned before, this is of major public health concern. And so because of that, Class A diseases are required to be reported immediately. And they have to be reported by phone. So when you call our office, the number is given there, and you can see the extension is 258. So you want to call that number, and if no one answers, do not leave a voicemail. You have to talk to somebody, you actually have to talk to a physical person. So you do not want to leave a voicemail. If you get the voicemail on this line, there will be directions on who to call next. So I think you'll press 0, and then it'll continue you on, forwarding you to the next person if you're reporting a Class A disease. So you cannot leave a voicemail. You need to contact someone immediately because of the severity of the disease or the potential for epidemic spread. So it is of a major public health concern, and you cannot leave a voicemail. Our office hours are generally 8 to 4:30. Now, if you're calling after office hours, you're going to want to call the second number there, and that is our sheriff dispatch. And so you'll want to call them and speak with them, and then they will get in contact with the health department. So if it's after 4:30, you want to call that line there. And if it is 8 to 4:30, you want to call the line above. But again, you need to talk to a physical person. You cannot leave a voicemail because of the importance of these diseases. And it doesn't even have to be laboratory tested. Even if you suspect any of these illnesses, you need to call. So if you suspect the disease, you need to call. The next is Class B reporting. So Class B reporting, again, these are not as important as Class A, but they still are of public health concern. So they still need to be reported, and they need to be reported by the end of the next business day. So they don't have to be reported immediately, but by the end of the next business day, they do need to be reported. So for Class B, again, you can call that phone line with the extension 258. You can leave a voicemail for these on that line. You don't actually have to talk to a physical person to report it. And then if you leave the voicemail, I will call you, or someone who is backup epi at that point will give you a call. You can also fax the reportable disease form to that number there, and I'll show you those forms here in a little bit. So you can fax that form, or if you are hooked up to electronic reporting through ODRS, or Ohio Disease Reporting System, you can do it electronically. If you're doing it electronically, generally that's through labs. If you want to report electronically and you don't currently have access, please give me a call. Again, at that phone number with the extension 258, that's my line. Give me a call and we can try and get you electronic reporting if possible. So, and that is a little easier. You just go right into the system and enter it. So those are some of the options for reporting. You cannot mail anything because it is not going to get here by the end of the next business day. So mailing is not an option. We need to either phone, fax, or electronically report. So those are our options. So again, we cannot mail any longer. So there has recently been changes to Class B. Zika virus has been added, so that is a new reportable disease. Diseases that have recently been removed are mycobacterial disease other than tuberculosis, or MOT. Those are no longer reportable, and typhus fever. So both of those are no longer on the reportable list. They have been removed, and Zika virus has been added. And that's the most recent updates and changes to the ABCs. There also has been changes before that, maybe a year ago or so. So some of the new ones that have been added in the past are chikungunya. That is a Class B, and that is a newer reportable as well. And then Class A had Middle Eastern Respiratory Syndrome, or MERS, and Ebola added in the past. Those are some of the other recent updates, but not the newest updates. And now we are on to Class C. Again, Class C is anything that is of unusual incidence. So any disease at all, if there's a connection between two people that you notice and it's not normal, give us a call. We can decide if it's an outbreak or not. So if you think it's unusual, just give us a call. If you're not sure if it's an outbreak, that is fine. We'd rather have you call and have it not be than have you not call and it be an outbreak. So always give us a call if you notice any other illnesses that seem out of the normal, or there's several people ill. So again, you have to report these by the end of the next business day, and you can call on the phone and notify me at that line there. I prefer you don't leave a voicemail, but if I don't answer, you can. But we prefer to have you talk to somebody because we do want to get on controlling that outbreak as soon as possible. So if you actually notify a person versus leave a message, we can start working towards controlling the outbreak and stopping the outbreak. You can also fax to that number below. So if you fax, again, there's not a form for Class C, so you would just use the normal reporting form and just fill it out to the best of your ability on what's going on. Maybe add an extra sheet to explain and fax that. You cannot electronically report this. It does need to be either faxed or phoned in. Alright, so I keep talking about all of these forms. So what are these forms? I'm going to go through that now with you on how to fill out each of them out. So this is the Ohio Confidential Reportable Disease Form. And again, this can be found in File 2 tab on the right hand side. and you can, it'll be named ODH Confidential Reporting Disease Form. So this is the form that needs to be filled out for reportable diseases. So this is the top part of the form. So you can see here. So in the top line, you're going to want to put in the disease that you are reporting. So what are you reporting needs to be in that top line there. It's going to be right there. Okay, and then the odors number you don't need to worry about because that is something that we fill out this here. That's something that we fill out, and it's a state number that's given to each case. Then we have the last name and the first name, middle name if possible, and medical record number. Now, medical record number is really important if you have it, because when I call a hospital, if I already have the number, I don't have to go through trying to find the patient with them. I can just give them the medical record number, and then they have the patient. So it's a lot easier when I'm trying to get information if that is included. Next is the address, county, city, state, and zip code. This is really important as well because I need the address for every case because that is how we decide which health department has jurisdiction on that case. So depending where they live depends on who the form needs to be sent to. Now, if you're not sure what county they live in, but you have the address, you can still send it to me and I can make sure that it goes to the appropriate health department. So if, for example, you're one of the main doctors in the county, you see lots of patients, you get a patient from out of the county with a reportable disease, you can still send it to me and I will forward it on to the correct health department. So the address is a very important piece. Next is the patient expired. So this is another important box to have checked because if they have expired, I have to kind of go about my follow-up a little bit differently than I would if they're not. So talking with family members, especially when they've recently lost a loved one, I'm sure as you all know, can be very difficult and a different approach is needed versus when I'm just talking to the patient. And I'll also have to contact someone else besides the patient. Then next is phone numbers. This whole next line is different phone numbers. This is how I do all of the follow-up. So I call the patients. So it's really important that this is filled out. Otherwise, I cannot follow up with them. And I'll be calling you to try and find out what their phone number is so I can talk with them. So phone number is really important. Then date of birth and age, gender, all of those are important as well, so I know that I have the right patient when I'm looking in ODRS. We have cases from several years ago, so if they had any other reportable diseases, I link them to the same case. But again, a lot of people have the same name, so date of birth and gender helps me decipher if it's the correct person or not. Pregnant and delivery date are really important because there's certain things that infants can be at risk for, certain reportable diseases. So, for example, hepatitis B. If the mother's pregnant, I would want to know that so we can follow the infant as well. So there's several of those that we want to know, STDs as well. We want to know if they're pregnant or not. So if you have that information, please enter that as well. Then race and ethnicity is really important because, again, I need this for every case. So a lot of people leave out the ethnicity. If you know it, please check the boxes so that I don't have to keep calling you to try and get that information or the patient. Was the patient contacted? So this is, have you notified the patient of their results or their illness? Are they aware? This is helpful because then I know that when I call the patient, I'm not the one notifying them versus their physician. I always try to contact the physician and make sure that they have notified the patient before I call. I don't like to be the one notifying because, again, I'm not their physician. I don't diagnose. I just try and collect additional information. So if they can talk to their doctor at all possible, I like to try and make that happen. So if I see that they've already been contacted, then I can go ahead and contact them. Sensitive occupation. This is important for numerous diseases because there are certain laws in the Ohio Revised Code that keep people from going to work if they have certain illnesses. So I need to know if they're a food handler, if they work with children or in a nursing home, or if they have direct patient care, and where. So if you know that information, please fill that out, because there are certain illnesses that we have to make sure they're not going to work because of the potential to spread the disease and get others ill as well, and we want to prevent that, and that's why those laws are in place. So if you have that information, please put that in there as well. So this is the general demographic information. Then we move into the next section, and this is if they are a minor, what is their parent or guardian's contact and their name, so that I can call them, because obviously we talk to the parents over the minors. And then who is their healthcare provider? So who can I contact that knows about this patient, that's treating the patient, and then what facility did they go to if they went to a facility. And then who is the form being filled out by? So who is submitting the form? This is important because if something on the form I can't read, or it's not filled out correctly and I'm not sure, I can call whoever filled that form out directly and talk to them, versus calling a physician's office and trying to have them figure out who filled out what form. It's a lot easier if the name is already on the form and I can just call for that specific person. So this section is the bottom section on the form, and it talks about their laboratory results. So if they had laboratory testing, or if we clinically diagnosed them, and what are their symptoms. And so we want to know the date that the report was filled out. That's on the left-hand side there. And going down that left-hand side of dates, we start out with when was the date of the report. So when are we writing this? Date of onset. When did the patient start having symptoms? Date of diagnosis. So when did the doctor diagnose them? Hospital admission date and discharge date. And date of death if that needs to be filled out. Otherwise, you can just write NA or leave it blank. I prefer NA because then I know it wasn't skipped. It was actually not applicable. So that is the left-hand side of dates. And then if you go back to the top by the laboratory confirmed, you'll see on the left-hand corner the date of result. So when did the laboratory result come back? And then when we go below that, and what's the laboratory's name, address, phone number. So what lab are we going to? Date of specimen collection. So when did we collect the specimen? And why did we collect it? So were we diagnosing it? Were we repeating a positive? Was it a prenatal? So what's the reason for the test? What is the specific test? So is it a culture, smear? What are we testing? And specimen is below that. And that's what type of specimen did you use? Was it blood, stool, urine? So what was the collection of specimen? What type of specimen? Then we go into treatment. So did we treat the patient? So now that they've tested positive or we've diagnosed them, did we treat them? So treated, unable to treat, you will treat them, or you referred them to another physician. So that happens a lot with hepatitis. They're referred to a gastroenterologist, or you're unable to contact them, or they refuse treatment. Then date of treatment initiated. So if we did treat them, when did we start the treatment, or when did we prescribe it? And what was the medication that we prescribed? So the drug, the dose, and the route. So all of that needs to be included on that line. Then we go down to the remarks section. In this section we have drug allergies. So do they have any drug allergies? This is a question that I have on every reportable disease. And then method of detection. So how was it detected? Why did we look at it? Was it a yearly screening? That's a lot of the case for STDs, or a prenatal screening, or for hepatitis they had risk factors. So why were they getting tested, or why were they there? And then in the line below that, you can write any additional comments. Anything that may be useful to me in the investigation follow-up can be written on that line there. Then below that, it has the please submit to. Excuse me. Again, you do not want to mail, but that is the address. You want to either call, which is the phone there. The fax number is in red, so generally you have this form, you're going to fax it to that number when you fill it out. Or you can email me. Again, I prefer the fax because email is not secure when it is going from email to email. So fax is the preferred method. But if you need to get a hold of me, my email is there. And then the phone number is right there as well. And again, you can either email this email, or the SMART email. So do you need to report negative results? Negative results can be very important for certain diseases, and we want them reported. So if it's a negative chlamydia, for example, I don't need that negative result. But if we have someone who tested positive for hepatitis antibodies and they have a negative RNA, we would want that negative result so that I'm not calling the patient and they've already had negative results. Or if it's a Hep B case, IgM and IgGs, one may be negative, the other may be positive. It can help us determine if it's an acute or a chronic case. So if you have a positive result for something and then you have additional labs for the same illness and some of them are negative, if you can report those as well, it can be very helpful in what the status of the disease is. So reporting negative results can be as important as the positive if they've already tested positive, like on an antibody or something like that. So we do want those negative results if you have them, and they can be of importance in the diagnosing and the status of the illness. So there are some other forms that are required to be that can be used to report as well for specific illnesses. So here's the varicella form, and the varicella form, let me zoom in a little bit for you. So this is the varicella form, and this is for varicella or chickenpox. Chickenpox is reportable, and this just asks more about the rash and when it was reported, who is diagnosing them, things like that. So chickenpox is a little bit different. Again, it has the rash and stuff like that, which we want this form filled out instead of the other form, or you can fill out both forms, but this one is a lot more helpful and has a lot of the specific questions for the disease. So this is the varicella form. Again, chickenpox is reportable and it is listed under varicella. This is the next form. Try and zoom in a little bit more for you. So this form is our HIV Adult Confidential Disease Reporting Form, and it can be found in the file section under Adult HIV Form, and the varicella form is also on the right-hand side under Varicella Chickenpox Report Form. So those both can be found on the right-hand side. So this is the adult form, so anyone over the age of anyone 13 or older, we want to fill out this form. So fill this form out as complete as possible. I know sometimes if you're a lab filling this out, you may not have all of the information. But for an HIV case, you want to fill out this form as complete as possible. The form is about 4 pages long, and you need to fill it out as complete as possible. Then you need to mail this form. So you cannot fax this form, email this form. This form needs to be mailed to the health department. And then please put confidential on it, and please give me a call when you send it, because then I can forward it right on to the state and never have to open it if I know it's coming. So this form, again, is for HIV. We have special HIV coordinators who follow up with all of the HIV cases, make sure they're getting treatment, make sure they're following up on all their cases. So those caseworkers will receive all of those cases for several counties. And this is, again, another HIV form, but it's a pediatric HIV form. So if they're under the age of 13, you need to fill out this form instead of the adult form. And this form is found on the right-hand side of the section for files. And it's under adolescent HIV forms. Again, this form needs to be mailed and marked confidential. And again, please call me so that I can be aware and send this on as well. So this form is lengthy as well, but fill it out as complete as you can and with as much information as you know. So why do we have you guys report, or what's the importance of reporting? So we want you guys to report to control and prevent diseases that are being reported. So if I can call and follow up and talk to them about their illness and preventing spreading it to anybody else, so hopefully they don't spread it to anybody else. We also want to determine disease distribution. So you can see in this graph below, it's pretty small, but it is Lyme disease for the state of Ohio. So because we track Lyme disease, we can actually look at the state and see which counties are more affected by specific diseases than other diseases. We can see the distribution of who, what's the addresses and who's actually having the illness. Are there clusters? We can look at that with having them reportable. If they're not reportable, we don't have that information. We cannot look at the distribution of the disease. And then also to prevent outbreaks. So again, if someone has salmonella and they're a food handler, we can prevent them from going to work until they're no longer communicable or can transmit the disease, so when they test negative. So then we're preventing them from possibly infecting anyone that they're making food for, and then we would have several people sick. So those are some of the reasons that it's important that we report communicable diseases. So here is a graph from the reportable diseases, and this is for Huron County from 2006 to 2015, and it's the number of cases that we get for each disease. So you can see that over time the sexually transmitted diseases is going up. We have seen more cases, and then also looking at hepatitis, that has been going up as well since 2006. And then you can see the tan line, vaccine preventables, that had started up relatively high, above 150 in 2006, and it dropped significantly in 2015. So we can kind of see what diseases we're seeing reported, what are they trending up, are they trending down, so we can kind of look at that and see what's going on in our county. So again here, you can see specific diseases broken out and the number of cases that we've seen. So for vaccine preventables, you can see that varicella or chickenpox was relatively high in 2006, and then it takes a significant drop from 2006 to 2008, and most likely that was due to having the varicella vaccine come out. But we can track that and see that, okay, it's, less people are actually developing chickenpox. It's not as common. And then the next graph on the right-hand side is the number of hepatitis cases in Huron County from 2006 to 2015. So you can see it's been going up for hepatitis C, and that can be due to several reasons. But we can look at that and then okay, why is it going up? What are some of the factors that are affecting this? Physicians are required to test people if they have risk factors now, which they may have not been required in the past. So there's things that can lead to that, and we look at that to kind of determine what is going on with the illness. And then we can also determine the disease distribution in comparison. So we compare Huron County to Ohio and to the national rates. So this is per every 100,000 people. You can see Huron County for gonorrhea is quite lower of a rate compared to the state and compared to the national. So that's really good. We want our county to be lower than the national and the state. And we can also compare it to other surrounding counties. We can compare it to peer counties. So we can use this to compare ourselves and see, okay, are we really high in a certain illness, and maybe, what's going on in our county that's not in others. And then chlamydia, again, is on the right-hand side. We can see that Huron County is below the rates compared to the state and the national. So Ohio and national rates are almost exactly the same. They're very similar. And then we're quite lower. So again, we want to be on that lower end. We don't want to see the super high rates. So that's good, but we can look at this as well. If you have any questions, please feel free to email me at smar, SCMAR, @huroncohealth.com, or you can call me as well at that 256 extension. So if you have any questions with how to report, what to report, or anything regarding this training or any other of the illnesses, go ahead and give me a call or shoot me an email, and I will do my best to answer your questions. And again, the forms on the right-hand side, so you're going to have the training form, both HIV forms, the adult and the adolescents. You're going to have the updated ABCs reportable form, so that is the list of all of the diseases in their class brackets, and then there's also a second page to that puts them in alphabetical order. You're going to have your varicella chickenpox reporting form, and then your ODH confidential reporting disease form, and that's the main form. So that'll be all the files that you have, and we have gone through all of those. Okay, so now that you've completed the training, you want to take the post-training survey. So please copy this link and take the post survey, and then you can expect an email from me with your certificate. Now, if it's been a few days or a week since you took this training and you're still not seeing a certificate, please email me or call me. I may have missed yours somehow, or something may have happened. So just give me a call and I'll make sure then that I send you the certificate. So the post-training is there. Just go ahead and take that, and then you'll be done with this training. And again, if you have any questions, feel free to reach out, and I will do the best I can to answer.